Hello everyone, this is Dr. Clark in the Center for Weight Loss Success, and good morning. I'm going to kind of do another video on intermittent fasting. This is just going to answer a few questions about intermittent fasting. There's some common ones that we get, kind of that often people think of and don't actually post them down there. But here are a few common questions about intermittent fasting. I gave you a few tips last time about exercise, so we'll talk about that just a little bit as well. So some common questions. One of the first common questions we hear is kind of, won't you lose lean body mass? Obviously in a calorie deficient diet, okay, which is if you're trying to lose weight, that's what we're trying to do, take in less calories than what we're spending. In a calorie deficient diet, if you're not getting enough protein in, you'll tend to lose lean body mass. So wouldn't this happen then in intermittent fasting then, where we're stopping eating for a period of time? Now, as I go back to one of those previous videos, is that basically with intermittent fasting, we have acute stress hormones go up. When acute stress hormones go up, there's actually a protective effect to lean body mass. Now that's just a short-term thing. So if acute stress turns into chronic stress, then basically, yes, you're going to lose more lean body mass. But in the short term, actually, growth hormone goes up. There's a protective effect for a short period of time in acute stress. And so you tend not to lose lean body mass. Now, certainly in our non-fasting state, then, we do need to make sure you're getting your protein in and you're exercising, which will then help preserve lean body mass. Second question is, should we exercise during fasting? I kind of went over this in this past video, and the real question is, the real answer is, it depends. And it depends on what your response is, as well as what you're trying to accomplish. Now, even if you're not exercising, I really encourage you to make sure that you're staying very active while you're fasting. Because when we sit around and we're not doing much, we tend to dwell on food. And if you're not eating, you're dwelling on food, it's going to be really hard to do this. So stay active. Now, should you lighten up on your exercise? Yeah, not a bad idea. Or again, as we mentioned last time, is that exercising under adverse conditions in the long run can actually help you. It just won't help you at that time, at that one time, because very likely it won't be your optimal exercise or your optimal routine right then. But in the long term, you may actually improve performance. All right, third question is how often? How often should you do this? Well, it probably needs to be done at least frequently enough so that you're getting some benefit from it. So when I say that, if you're doing it once a month, there may not be a whole lot of benefit to it. So probably once a week, if you're skipping a day, which is typically, if you're skipping a day of eating, that's actually around 30 hours or so, because it's from the evening before then the whole next day. So if you're doing it probably about once a week is fine. I talked about that 5-2 plan in one of the videos too, which I won't go into that right here, but that's another way of doing it. So about once a week. And kind of next question, should you take your vitamins while you're doing this? A lot of people don't tolerate vitamins, on an empty stomach. And so if you're one of those people, then the answer is no, don't bother taking your vitamins if it's going to upset your stomach. Now, if you're one of those people that, I take my vitamins, doesn't matter, then sure, keep taking your vitamins during that time. Reality is that nobody gets vitamin deficient in 24 hours. I mean, vitamin deficiency is actually a long-term thing. So skipping your vitamins one day out of a week, that's not going to be any problem at all for you. So nobody gets vitamin deficient in the short term. And then finally, who are those people that really shouldn't do this? Who shouldn't do intermittent fasting? Well, if you're under high stress, high stress and then throwing fasting on top of it, probably not going to work real well. If you're overtraining, and you're working really hard and you're overtraining towards some event, okay, overtraining, this also is you need to get the calories in then too. If you have really poor quality sleep, it's like intermittent fasting is also going to be very difficult. Now, poor quality sleep tends to increase chronic stress hormones then. And then finally, just from some health perspective, those who are already underweight, it's like that's probably not a good idea to be doing intermittent fasting. Children, so they're growing fairly quickly, and therefore they need to be kind of getting their calories in, getting their nutrition in on a routine basis. if you're pregnant, kind of same thing along those, you're developing a baby there, so intermittent fasting probably is not a good idea then. And finally, another reason, just if you're breastfeeding. If you're breastfeeding, you want to optimally be able to produce the milk for the infant, and subsequently then intermittently this acute stress may not actually help you there. And then finally, if you're on what I'll call the standard American diet, or the SAD diet, standard American diet, which typically means you're eating a lot of processed food, a lot of carbohydrate, it's probably not going to do you a whole lot of good either. Now, it will help you decrease some calories, okay, if you're not, but I'd certainly encourage you you should be eating, healthy foods, which are basically foods that have no labels. The best food, the best nutrition comes from food that has no labels on it. So, there's a few questions I often hear, and I hopefully answered a few of them. If you have questions or that wasn't clear at all, just comment below, question below. We'll try to do our best to answer them. Next up, which will probably be one of the last on our intermittent fasting little series here, I'm going to give some of what I'll say my top tips for getting started. And then I am probably going to try to do this over the next couple months. I'll keep you updated as how's it's going. I'm not be doing it for weight loss, but just kind of seeing how do I tolerate it, does it work well, how do I feel. Again, questions, comments, post below. Have a good day. Take care.